Well, hi, I'm Chris Cannon with my friend and colleague Deepak Bhatt, here to do a preview of what we'll be covering on CardioSource from ESC 2013. In addition to the trial summaries and journal scans, we'll have video wrap-up and discussion of both the key trials individually and of an overall look at all the different trials each day from ESC. But to begin with, I think we start out on on Sunday with a lot of anticoagulant, antithrombotics. Do you want to give a preview of what you're looking forward to?
Sure. Well, I think the TASTE trial will be particularly interesting. That's a very large trial of ST elevation MI patients randomized to aspiration of thrombus versus conventional PCI. So hopefully that study will help nail down whether that procedure, whether signals that it's useful, really does improve clinical outcomes or not.
Yeah. So mechanical antithrombotic therapy. I just had a patient have that a week ago. So be nice to get large evidence.
Yeah, there are meta-analyses supporting it, but it'd be nice to have an individual trial power to see whether it does or doesn't improve clinical outcomes.
Yeah. Now, I guess the ACOAST trial is also one of early prasugrel.
Yes. So that's a study in non-ST elevation MI patients of prasugrel up front versus right at the time of PCI, which will hopefully provide evidence specifically about prasugrel and pretreatment, but also help us in the whole discussion about whether pretreatment's really warranted in terms of the potential downside risks of bleeding versus some potential reduction in ischemic events.
Well, it sounds great. I think other things are some of the novel anticoagulants. The first data from a large trial with edoxaban from the Hokusai VTE study. Also, the Tau study was an IV direct 10A inhibitor we heard didn't work, but in acute ACS. And then also the dabigatran and mechanical valve study, which will be interesting. That also didn't work, and something important for us to understand a little bit more. I think on Monday is a big day, and you'll be the headline news presenting the results from the SAVOR trial, one of two large outcome trials of the DPP-4 agents.
Right, so these are trials that the FDA mandated for the evaluation of the cardiovascular safety of novel diabetes agents. So we'll learn a lot more that day because there'll be two of these large trials presented.
It'll be terrific. And then on Tuesday, we have the CHAMPION trial. So again, you're at the center. This will be Christian Ham presenting, I guess, the whole program?
Right, so there have been three CHAMPION trials. CHAMPION Phoenix was most recently presented at ACC, but prior to that, CHAMPION PCI and CHAMPION Platform. And this is a pooled analysis, a per patient level meta-analysis of all three trials. So that should be interesting, I hope.
Yeah, and so the Cangrelor is the IV agent, not yet approved, but studied in the cath lab as a very high level of platelet inhibition.
Yeah, so with around 20,000 patients, it's a large analysis, and we'll hopefully learn some insight into the value of Cangrelor.
Oh, it's terrific. I think other things on Tuesday are a neat, rapid, as they call it, an instantaneous rule-out MI with high-sensitivity troponin and copeptin in chest pain patients. Also, Euro-CRT, which is a study of CRT in patients with dysynchrony but a narrow QRS. So another important area. There's been one smallish trial, so looking forward to that.
Yeah, that'll be good.
And so many other things. Also on Wednesday, some epidemiologic studies on sodium and sodium excretion, a hot topic in hypertension, certainly.
Yeah, a lot of controversy around the whole topic of how much sodium is okay in terms of blood pressure risk. So I think this study, which also has urinary sodium measurements, will be very, very useful.
Yeah. So we want to encourage you to follow all of these and many other studies we'll be covering on CardioSource. So for CardioSource News, I'm Chris Cannon with Deepak Bhatt.